giving folks a chance to hop on. We'll probably make this pretty quick today. We have some interviews today, so. Okay, we'll go ahead and get started. Just kind of want to give a quick update. You're going to see an update in numbers today. We have had 4 new cases reported today. We are investigating those cases right now, so I don't have any additional information, but you'll see that information reflected in the 4 p.m. update today. We are closed tomorrow for Truman's birthday. That is a state holiday. That's a normal holiday for us, so the office will be closed. We will continue investigating positive cases over the weekend if they come in and continue working with our new cases that have been reported today. I want to let you know that some of those cases we do believe they are connected. So that's the good news. So these aren't 4 separate cases. These are some clustered cases. But it's important to know that we are going to see that update here at 4 p.m. at 34 is what we're going to be at. Or sorry, apologies, 33 is the number that we will be at 4 unless we get more reported today, 33. I just want to talk a little bit about the lifting of the stay-at-home orders. Of course, you know that was done on May the 4th. And so, as businesses reopen and we start heading back to normal life, we need to understand that we still need to be cautious and we still need to follow the recommendations that have been set forth by the CDC and other professional organizations because we don't want to go back to stay-at-home orders. So to prevent infections, we need to follow those guidelines. And those really are some basic things that we've been talking about for years, whether that means staying home when you're sick. Those are things that we've recommended to people for years to prevent infection. Washing your hands for 20 seconds, especially after you've been in a public place, you've handled money, you've handled papers, you've blown your nose or coughed, that type of thing. But regular and frequent hand washing is important. If you're not able to access, a sink and soap, if you have hand sanitizer, that is appropriate as well. That has at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands, and clean and disinfect frequently touched surfaces daily. CDC has all kinds of information about disinfecting products, so you can utilize that there. We have frequently asked questions on our website, and it also has a lot of definitions when we're talking a lot about isolation and quarantine and confirmed cases and probable cases. What do those things mean? That is on our website under frequently asked questions. So you can view that there, along with some links to CDC, frequently asked questions, and then the disinfection products that you can use. When you're sick, if you become sick, you need to contact your healthcare provider. There are several healthcare providers in the county that are testing right now. And so we do have resources in the county, but you need to reach out to your healthcare provider to be screened. Also use the CDC symptom checker on their website to help you. But if you have emergency warning symptoms like shortness of breath, blue lips, confusion, those things are emergency warning signs, and you need to seek medical care right away. If you're calling 911, please let them know that you think you might have COVID. That a way that they are taking the appropriate precautions and know what the risk is to avoid them getting infected and potentially spreading it to more people. So please let them know that before going to the hospital. Make sure you follow the instructions by your doctor as well, and take your precautions when you go into public setting. It is recommended that all people that are going into public settings wear a mask to prevent spreading your germs to other people. So when you wear a mask, you are protecting others around you. And when they wear a mask, they are protecting you. And so that is recommended, especially in places that social distancing is hard to do. We are also recommending that we not do mass gatherings at this time. This is a recommendation, not a mandate. The plan that has been set forth by the state is the minimum requirement, and then we have additional recommendations and guidance up on our website as well, but we would recommend against mass gatherings at this point. And I think that's all on that. I want to talk a little bit about some of the things that we've been working on. Guidance, of course. We've talked to a lot of businesses this week about reopening and what that looks like for them and trying to help them in that process. Of course, there's no guidance for every single job in the United States, but it is taking the guidance that's out there for businesses and adapting it to your business or to your job. And so those things are really important, and there's lots of resources out there on CDC's website. And then we've got some other resources that we've tried to compile that are more locally specific on our website, or things that can help those businesses along, including fitness centers and summer sports, those types of things. So there's some extra information on our website. Okay, I am going to back up and try to hit some questions. I know we've got kind of a lesser audience today, so we may not have just a ton. I see someone asked, can we have yard sales? That's not specifically addressed in the state order, so the answer is yes. But there's some kind of recommendations and strategies that really need to be considered. I would really suggest not having a garage sale inside your garage. I would suggest outdoors, possibly posting signs asking people not to handle items. If you can, have sanitizing solution there so that they can use that, that sort of thing. And of course, not holding a sale if you're sick, but certainly having it outdoors, posting some signage about risks and that type of thing will help. And trying to encourage and posting signs too that encourage social distancing to make sure that if you have a lot of people coming to the yard sale that they're staying apart. So scanning back through. See a lot of comments, but I haven't seen. How do you eat with a mask on? Steak and Shake. We're wearing masks. Customers, we had to eat. Yeah, so if you're going out to eat, it's going to be really hard to wear a mask and eat. You're not going to be able to do that. My suggestion would be that, especially people who are vulnerable, elderly persons, we're still asking that they shelter in place. Again, this is a recommendation, not a mandate. We ask that they continue to shelter in place. You can still use things like curbside, to go, all of those types of things. But obviously, if you're going into an establishment, you're not going to be able to eat and wear a mask. My suggestion is if you're going into an establishment that you make sure that you are social distancing. So 6 foot away from other people. And that doesn't include the people in your household. So like if me and my husband went to dinner, we are our own family unit. And so we need to stay 6 feet away from other family units. Okay. So that's just some suggestions for when you're going into restaurants, if you're going inside to eat. Guidelines for going to public swimming pools. When will they be open? Or will they be open? I haven't seen a ton yet, anything specific for guidance on swimming pools. I'll look and see if I can find some stuff and see if we can get some things up on the website. But the same rules are going to apply for social distancing. And I realize, being realistic, that is tough. But those things still apply even in those settings to try to keep people separated and keep sick people from healthy people. So people who are sick should not go out to those places, same as we're recommending for people to stay home when they're sick. But the swimming pools, I haven't seen anything very, very specific on that. I'll see if I can find that information and try to get that maybe added to summer athletics, some of the guidance that's up there. But again, it's really all about social distancing, hygienic practices, and then, staying home when you're sick. So, I see a question about beauty shop appointments. I'm just looking at the clock up there. We do have some information up on the website for salons and guidance for them. Beauty shops are open. There are some guidelines that they can utilize to, space out appointments, maybe doing appointments only, keeping those chairs 6 feet apart, that type of thing. And that guidance is up on our website, so I would refer back to that. Do you know if face masks will be available to purchase commercially? I have seen masks for sale on Amazon, but the face coverings do not have to be surgical masks. Surgical mask and N95s should be reserved for medical personnel. So you can also utilize cloth face coverings, and so this is mine. My mom made this for me. We don't take care of sick people here at the health department typically, outside of STDs and some other things. So we are utilizing cloth masks here in the office. And so cloth masks you can do. I know you can buy those. You can also just use like a bandana or a scarf. So it doesn't have to be a surgical mask. I see some questions specifically about tattoo shops. Those are, again, kind of similar to any salon, similar to something that you can't social distance for that. And the state does say that, if professions that you can't social distance, that you should do your best, again, taking precautions to wear masks. I would suggest that's a place where you're in a public setting, that the person who is performing the tattoo and the person that is getting the tattoo, both of those people are wearing masks. And then, of course, hygienic practices, that sort of thing. Maybe even limiting the space between the people who are getting a tattoo, giving a tattoo, and other people who are giving a tattoo, to, again, social distance as much as possible. But obviously, if you're giving someone a tattoo, you can't stay 6 feet away from them. But they are allowed to operate. But there are guidelines out there, general guidelines for businesses, and they all circle around those things. Monitoring people when they come in your business, whether that means some places are taking temperatures, some people are doing questionnaires. We're taking temperatures here for people coming into the office. Also giving questionnaires about people or to people. So have you been sick? Have you been around someone who's had COVID? Those types of things to try to make sure, again, you're separating sick people from healthy people. And, we've heard a lot about asymptomatic folks, but that's a tough thing, because if you have people who are asymptomatic and that are infected, it's going to be very difficult for those people to know that they're sick to stay home, which is why masks are very important. Social distancing is very important. Hand washing, those things that, we've talked about for years for infection control, those things are extremely important. I see another question about public swimming pools. Again, I've talked to a few city leaders, and my understanding is that they are planning to do that. The statewide plan does not prevent them from doing that, but there's guidelines that, or guidance that is in place for that. Or, we've spoken with them about some strategies on how to do those things. And I'll try to find some specific information and have that up on our website too. I see some questions about graduation for seniors, and I've seen some information out there about that. I've seen some of the schools that are planning some things, and then I've also been told that DESE is working on guidelines for that. And really, again, it's going back to those things with social distancing. And so I've seen that there are plans out there for graduation, and even some things that are kind of preemptive to that, of doing some drive-by type of things, and then doing a ceremony later in the year, postponing that. And certainly we'll have a good picture, a better picture of where we're headed as we get to the mid-month and headed into June. So. Will you do any inspections of restaurants to be sure that they are clean and have sanitized? So we have the health inspectors in our office, environmental health, there who inspect the restaurants for cleanliness and environmental health hazards. And so there is going to be guidance coming from the state to increase what they already inspect normally. So prior to COVID, just some information to help them when they're going out into the restaurants. We have not seen that yet, but we normally inspect restaurants anyway and respond to complaints, that sort of thing. So that's something that we already do. Can you say which towns these new cases are from? You'll see the breakdown for zip codes at 4 p.m. How about church service? We have information up on our website for the church service. I'm trying to skim through here. Sorry, I'm just trying to skim through. I see some folks talking about where you can find masks. Once there is a vaccine, will we be able to stop wearing masks? I think from what I have read and heard that, we're probably quite a ways off from a vaccine. I can't say for sure as to what's going to happen in the future, but right now the recommendation is that if you're going into a public setting that you need to wear masks. So I would ask you to do that. Again, you are protecting your fellow St. Francis Countyan or your fellow community member when you do that. And when they have a mask on, they are protecting you. So that is the recommendation. Can students needing vaccinations for next school year start coming in? Yes, so we are open. We've been open, but only by appointment, and the priorities have been childhood immunization. So right now we are open. It is by appointment only, so you need to call the health department to make an appointment. I would suggest that, folks who need vaccinations for next school year, so kindergartners, kids going into 8th grade and 12th grade are going to be required to have immunizations for school. And now is the time to do that. We are going to be working with the schools to provide immunizations in the schools, which we usually do on the latter half of the school year. But because of COVID-19, we have not been able to do that. And so we might be doing some extra work around back to school, because if you've ever been in our waiting room in August, it is packed and there's no social distancing. And I expect that that might be something that we're still thinking about in August. So if you want to come in now to get your vaccinations, I strongly recommend that. We're also doing PPDs, presumptive eligibility applications for temporary Medicaid for pregnant women. I'm looking at my time because I've really got to hop off here. I have a call here in like 10 minutes. So, but we are doing those nursing services as well, but you need to call and make an appointment. We are still, as we get these cases trickling in, like the 4 today, that takes a lot of our time to do those investigations. And so that is still our #1 priority. But we are providing our normal nursing services for the most part. But give us a call and we will get you scheduled. We want to make sure to space people out when they're in the building, and you will see our employees wearing masks when you're in the building. I think I'm going to try to answer maybe one more. Can you confirm if the 2.5 filter inserts are better than just cotton or other materials from homemade masks? I mean, certainly surgical masks are better than homemade masks. N95s are better than homemade masks, but the recommendation is that folks use cloth coverings over their nose and mouth, and that does not include surgical masks and N95s. So N95s and surgical masks really should be for healthcare providers. So that really is the recommendation, to use a cloth covering. If you have surgical masks, you can use those things, but it's not recommended for the general public to have the surgical masks and the N95s. Again, that's because of the PPE issues that you've seen out there. But right now, our hospital's doing well on PPE, and their capacity is good right now. So we're thankful for that. We're going to continue doing our surveillance. We're working on some active surveillance programs in congregate settings. So places like shelters, jails, nursing homes, which are already doing a lot of those things by screening people when they're coming in for temperatures and that sort of thing. But we're working on some of those things as well. We know that testing has increased, and I know that the state is planning an initiative to continue increasing testing as that continues to be an issue. But over 800 people have been tested that live in St. Francis County at this time. And I hope that that continues to be increasing as we go, and that'll help us identify cases so we can isolate and quarantine appropriately so that those people are not spreading it to other people. I just want to encourage you before I hop off here, and I'll try to go back through and, look at some of these comments, but, we've talked about really those basic things. I mean, the stay-at-home order's over. We do have the statewide recovery plan in place, and that is out there. You can link that. You can get to there from our website. But I would encourage you to take a look at that. Take a look at the guidance on our website. And, please remember that all of these things take every last person. There is nothing that any one agency is going to be able to do to slow the spread. And we expect to see more cases, but we don't want to see a surge of cases. We would prefer not to see any, but being realistic, we know that we're going to continue to see cases, but these things all take every one of us doing them. We have to work as a community. We need to express compassion and kindness in this time and work together so that people don't get sick. We appreciate you. I know this is a difficult time. I know you're restless and want to go back to normal life. We all do, and we are headed there, but we've got to be careful about the way we do it. And so I really encourage you to look at that guidance, look at CDC's guidance, and follow it. And please reach out to us. If you have questions about how reporting happens, how we do the things that we do, reach out to us. We're happy to talk with you and answer those questions. We've got environmental health still here in the office a lot, and then they'll be going out into the field a lot more as things start to open back up. But the nurses are here. We're happy to answer questions. Please feel free to give us a call. If you connect with us on Facebook, again, we don't have somebody who monitors that all day. That's monitored here and there and as we post updates. But again, I encourage you to give us a call, 573-431-1947, or connect with us on our website on the Contact Us tab and send us an email, and we will get back to you. So we appreciate you. Thank you so much for being on. I will see you next Thursday at 2 p.m.